Let me begin with Professor Moodley on the question of if we had the Serum Institute at full production and exporting vaccine to other parts of the world, if we had South Africa producing both the AstraZeneca as well as the Pfizer, the J&J as well as the Pfizer vaccine, would that remove your objection to having electronic vaccine certifications? And if it wouldn't, at what point is there enough production locally in the global South to make these certifications ethical in your view?
Well, the population on the African continent, as you know, is 1.3 billion. And in most countries, less than 2% of the population has received one dose. The local production in Africa is only just starting in terms of the J&J vaccine, with the Pfizer vaccine anticipated to start production in the new year. We do have a large amount of Pfizer vaccines delivered to the country now under various different programs, some as donations from the United States, etc. And so in the next 2 to 3 months, we anticipate 20 to 30 million Pfizer doses, in addition to J&J vaccines. Just over 8 million of our population has received at least one vaccine dose to date. The local production will certainly increase capacity, increase access. South Africa will be a production house for the rest of the continent as well. There is personally,
let me push you on the question of when is enough to make these electronic vaccine passports ethical?
Well, as things stand,
we know the problem.
People have spoken about herd immunity, and everyone's aiming for 67% of the population being immunized to reach herd immunity. That may not be accurate. In fact, given the variants that are circulating, one may need about 84% of the population to be immunized to reach that level of population immunity or herd immunity. There are also other arguments that perhaps the whole concept of herd immunity is a fallacy. And about 80 scientists have written a letter to the Lancet recently to argue that point. So
let me ask you again.
Figures is not always accurate. But
so what's the threshold in your view, or is there no threshold that makes these passports or certifications ethical?
I think these certifications are important. I think they should apply both ways. So what is not fair is for South Africans or other Africans to have to produce a certificate on entering Europe, and for that not to be the reciprocal case where Europeans or Americans are allowed into African countries without an equivalent certification. So I think that is one issue. The exact point at which it's going to be possible for everybody to produce a vaccine certificate is a difficult question to answer because of the variability in rollout of the different vaccines. But certainly, if you look at the United States and Britain, at their similar levels of vaccination, they're allowed to travel. Other people in other parts of the world should have the same privilege.
Okay. Vardit, Professor Ravitsky, I was unclear what you were actually for, in the sense of, do you think it should be just open borders, or do you think at the other extreme it should be totally closed and we should shut down international travel because it's inequitable that some people have vaccines and others don't? What is your actual position about what we should be doing today if we should not have these electronic certifications because of inequities of access to vaccines?
So other than promoting global vaccine equity in every way that we can as professionals, as experts, until we have access to vaccines around the world, what I'm proposing is a nuanced approach that includes an element of a certificate with others. Let me give you the example of Israel, where I am now. You need to test before you leave, you need to test upon entry, and then you have to quarantine for 14 days. If you have proof of vaccination, 2 doses, you can get out of this quarantine 24 hours after arrival with a negative COVID result. If you don't have proof of vaccination, you can only attempt to get out of quarantine after 7 days. And then if you do nothing, you're liberated from quarantine after 14. So it's a combination of testing, quarantine, and the element of vaccination. And this can be further nuanced about how many doses you have, what is the level of infection in the country you're coming from. I see this as a cluster of measures that have the value, obviously, of public health protection that allow people entry, even if they come from a country where they did not have access, but creates further burdens on them to protect the population where they're visiting. So I hope this clarifies.
So it sounds like, in principle, you're for electronic certifications, allowing people free entry or entry with a negative test, as long as other people can come in and are subject to the quarantine. Govind, did I get you right, Professor Ravitsky?
I think every country has the right to protect itself, but let's not make this black and white, vaccinated, non-vaccinated, but create a cluster of measures that achieve the highest efficacy, of which vaccine is one element.
So the vaccine passport isn't a blanket, not having a vaccine is not a blanket prohibition. Govind, would you agree, Professor Persad, would you agree with that position?
So I think it would certainly be an advance over either of the sort of extreme alternatives of closure or opening without regard to vaccination status. I think the question is, you might think about it, and this comes up domestically as well, is basically a question about what sorts of accommodations ethically should be afforded to people who aren't vaccinated. And, you know, some workplaces domestically, right, similar to what Professor Ravitsky has suggested, you might use testing as an alternative, more regular testing, masking, things like that. I think the challenge for some of the alternatives is twofold. One is that really just having a negative test at a point in time, as Professor Chertoff pointed out earlier, is quite different from being vaccinated. And so I would be inclined for countries that have supply to think it might make sense to create a vaccination requirement for people who are coming in during that 7-day quarantine period to ensure sort of longer term protection and protection from spread. The other issue that I'm not sure what to think about is Professor Ravitsky's suggestion that you look at the viral rate in the country the person is coming from. What I worry about is this: if somebody is fully vaccinated with a high efficacy vaccine, but they're coming from a country that is very poor and dealing with a lot of spread, I worry that it may actually be more inequitable to have a higher sort of differentiation based on nationality than based on individual protection from risk. So I think it sort of depends, again, obviously, on how protective a given vaccine is. I agree with the idea of having an approach that considers multiple risk factors. And I think the question of what a sort of fair or ethical accommodation is for unvaccinated people depends on how we think about the spectrum of risks they might face themselves or pose to others.
Dr. Saenz, is this position of we have multiple channels to get in, one is vaccination, electronic vaccination, certification with a negative test versus quarantine, is that a position that you could endorse as an ethical approach?
Yes, and I think that we also have to keep in mind that we have to make this assessment on the basis of the most accurate and recent data, for example, and specifically on transmissibility of COVID-19 by those that are vaccinated. I think that we're learning this week a number of things, and I think we have to act based on that. I think that using the combo approach, as it were, has also can also be responsive to equity and to the fact that people in some countries have almost no access to vaccines. And I think I think that this discussion would have been a lot easier 2 weeks ago, before the knowledge that we have about the Delta variant, and it forces us to continuously revise our judgments. Overall, well, good ethics needs good facts, and we've had some unexpected facts lately.
So one of the questions I wanted to ask is, do you think it's ethical to require reciprocity in some way, which is that if vaccine passports are going to, or vaccine certifications are going to be accepted in South Africa, does that mean that countries that are permitted to come in need to have the reciprocal, that if someone has a vaccine from South Africa, they should be admitted? Is that a sort of ethical requirement, or is the asymmetric use of the certifications make them unethical in those contexts? Anyone, or do I want to call on someone?
I'll jump in, Zeke. I think that the reciprocity of country versus country, like, let us do this and we'll let your citizens do this, is very impractical. What I'd like to see is global harmonization. I'd like to see us bioethicists contribute the conceptual framework for how to make the entire structure ethical, fair, and as equitable as possible. And then for all nations to agree that this is what they will require, taking into consideration Carla's point about shifting data, shifting infection rates, variants, efficacy, etc. That would be, that from an ethical perspective, ideally, same requirements across the globe, with also the pragmatic harmonization of how we present the proof of vaccination and how governments deal with this data. And obviously not very probable that this will happen, but I think that the expectation that, sort of, you let us and we will let you, country versus country, one-on-one, is not practical at all.
Professor Persad, you wanted to weigh in?
So I think an important distinction here is between the differential treatment of the same vaccine, which I think is not easy to justify. I think it's problematic. And on the other hand, something that I think the WHO has called for that I think violates Professor Saenz's sensible principle of good ethics depending on good facts, which is insisting that if there's a vaccine certification, all vaccines should be treated identically. I think if there's evidence, and I think there is some preliminary evidence, that different vaccines may differ substantially in terms of their efficacy in preventing infection and ensuing spread, particularly with respect to the Delta variant, it can be legitimate to take that into account. So not to treat the identical viral vector vaccine differently if it's made in South Africa versus made in America. I think that's not ethically justifiable. But I think treating an inactivated virus vaccine that looks like it has much lower efficacy against certain outcomes differently looks like it would be potentially justified and in keeping with the idea that good ethics depends on good facts and recognizes differences.
Dr. Moodley, I wanted to ask a question. Do you feel that the vaccine certification would be more ethical if it were time limited and focused only on COVID, or more ethical if it were more generalizable and longer standing, allowing sort of one-stop shop, as it were, that we heard about yesterday, just getting everything in one place digitally, more secure than our current system? Does that actually make it more palatable or less palatable to you?
Well, there's a precedent set in terms of the yellow fever vaccine. For those of us who travel to countries where this is a requirement, we've been producing these certificates for decades. I think that with COVID vaccines, we know there's the duration of protection from a vaccine remains unclear. So as we are currently discussing this matter, people have had vaccines, but how long those vaccines are going to protect them for is another matter altogether. So one would have to have a more comprehensive record in terms of when one was vaccinated, how many doses, etc. So those vaccine passports need to have much more detail. I think if the more comprehensive they are, the fact that they are digital rather than paper-based, would facilitate the process and make it more palatable.
So it sounds like you're saying that the key question goes to something that Professor Glenn Cohn raised in the previous panel, which is this question of how much information actually needs to be captured. And you're saying that actually, I think interestingly, the more information we have, the more ethical they become, because we have information about the duration, which ones you received, et cetera. And that actually makes them more useful and therefore, to some degree, more ethical as a means of facilitating movement.
Correct. I think it's a complex disease, and it's a complex, we have variants circulating all the time. Some vaccines are more suitable for some variants than others. And so depending on the country that you come from, what the particular variant is, and the country that you're visiting and what the dominant variant is there, one may need to view the vaccines differently in that respect, not in terms of where the vaccine is manufactured, but in terms of the efficacy of a vaccine against a particular strain. So that type of information is complex and needs to be captured.
Dr. Saenz, do you agree with that? Do you think that having a more comprehensive system that is not just COVID focused actually makes this vaccine certification more equitable?
Do you mean that's not COVID focused or that's not COVID vaccine focused?
It begins with COVID, but it expands and has a longevity beyond COVID, assuming that we get beyond COVID.
Well, with respect to COVID first, the recommendation actually of the emergency committee of the IHR has not, on the need to expedite the work to establish appropriate means to document COVID-19 status is not restricted to COVID-19 vaccination. And we're talking about something for travelers. It includes COVID-19 vaccination, history of COVID infection, and COVID tests results. So that is really consistent with many of the discussions we've had about this need to go for what I call the combo approach. In terms of a more robust vaccination-wide robust approach, it certainly makes sense. It wouldn't make sense to continue having our yellow card on paper while we already have a more efficient system to record vaccination. And it wouldn't make sense not to use that. And in the PAHO region, in the Americas, we've worked way before COVID on electronic immunization records with member states, and I see that being like a proper ground also to use this not only at the international level of international travel, but also for other internal purposes as well.
Good. Dr. Ravitsky, you're going to have the last word here before I summarize.
Just to point out that the more libertarian discourse in North America focused on, as Carla said in the beginning, my rights, my freedoms, my privacy, the government should get its nose out of my medical data, etc. That made the debate around vaccine certificates very difficult in those countries, Canada and the US. A part of what people found more palatable was the notion that this is just for COVID and it's very temporary. And any sort of certification will disappear when the pandemic is announced is over, and that this data will not be kept. I think what makes international travel so scary for people is that it's not just my government, it's a foreign government that will have this information about me, and they'll keep it forever, and who knows when it will, catch up with me in 50 years. So I think that at least in certain cultures with a more libertarian discourse, the notion that it's temporary and limited to COVID has been a selling point and made people feel that it's much more ethical. So I think there's a really interesting cultural perspective issue here.
Thank you. I think actually we've made some ethics progress here, if I can be so bold, to suggest that there is a way. I think that all of the panelists agreed for the electronic vaccine certificates to be ethical and to be used and to overcome inequities if they're not the only mode of entrance, but they're combined with other modes and don't exclude people who aren't vaccinated. And similarly, that if it's unvaccinated by choice, more onerous processes like 14-day quarantines with multiple tests are possible to implement ethically and differentiate people in that circumstance. I think in that context, the real ethical issue is not vaccine certification, no vaccine certification, but how it fits in with a system of entry requirements where if you're not vaccinated because there's no access to a vaccine in your country or limited access and you can't get it, you're not totally prohibited. Thank you, Professor Ravitsky, Professor Moodley, Professor Persad, and Dr. Saenz. Great panel. Thank you very much.